Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you once again for having me on the program.
Yes, sir. Let's begin with some international news. Now, we've seen steady reports of a new variant in the coronavirus. What does that mean scientifically?
Well, viruses mutate, and what has happened now is that the United Kingdom, because of the types of tests that they've been doing, have been able to detect a particular strain of this SARS-CoV-2 virus. And this particular strain, they start looking at it from since September, but they have confirmed now that there are a number of mutations. They have detected on this particular strain about 23 different mutations, and because of that, they thought it's a little bit worrying.
All right. What does that mean for us here?
Well, among the things when viruses mutate, you want to know whether or not this new strain would change its characteristics, so whether it would become more transmittable, whether it would cause severe disease, so the outcomes are worse, and various other things. So what right now they're trying to investigate is to find out whether these things are happening. So, for example, a lot of the scientists in the UK believe that this particular strain would increase transmissibility, meaning that someone who has this particular strain can easily pass it on to others. And that is something, if that is really happening, then we can see a faster spread of the disease. They have also seen a particular mutation, and they're investigating that, which can have an impact on severity of the disease, but they're not sure as yet. So as more investigations are done, we'll probably get a better picture of what's happening.
Okay. As we're talking international, UK specifically, would there be any specific changes with regards to guidelines in January? I know there have been some imported cases, more from that side of the world as opposed to the US and Canada and so on.
Well, we've seen as a reaction to the UK announcing that they have found a new strain, that a number of countries have moved to stop air traffic between themselves and the UK. So a number of countries in Europe have done that. I think Canada, Russia, and some others. So we have had some discussions with CARFA yesterday, and we're trying to get a consensus of a Caribbean position, how to react to this. And our advice from CARFA is that we should wait a little bit to see what is happening and to get more scientific information before we make a decision. On the other hand, there are two Caribbean countries that have proceeded in restricting flights out of the UK, and that is Jamaica and Grenada. But the rest of the region has not done so as yet. So we'll await some further guidance from CARFA, and they have been talking to their virologists as well as virologists from PAHO. So once we confirm some of the mutations and understand the impact that these mutations might have, then we'll be able to make a more definitive pronouncement. In the meantime, CMO is going to meet with some key stakeholders today to appraise them of the new strain, some of the scientific information that we have on hand, and so that persons here are alerted to this new strain and the possibilities of what we need to do.
Okay. Minister, we're still out international news basically, but in terms of remdesivir, moving now to drugs, we've seen positive reports internationally, and we have been using it here as well. Could you basically give us your thoughts on how much of an impact that has had on our treatment right here?
Well, it's another medicine that we have added to the set of medications that we have. None of these medicines are magic bullets. Um, there isn't a cure for COVID-19, and therefore, while the medicines might help some people, it's not going to be something that cure everyone. And therefore, we still have to look at various options and see what we can do for that patient. We now understand more about the course of the disease and how people move from one phase into another. What are the kinds of reactions to expect? How to manage those better. So one of the biggest challenge was to reduce the effects of a cytokine storm that some patients would have. How do we deal with that? And I think the doctors now have amassed a lot of experience in how to manage those types of patients. So this has been an ongoing exercise, and in addition to having medication, it is also about some of the other things like the use of oxygen, ventilation, and so forth. So a combination of these efforts for the more severely ill patients and critically ill patients, a combination of these methods is what would help to manage these patients better.
Right. As you mentioned, oxygen and ventilators and so on, we haven't spoken about it in a while, but what is the capacity like in terms of all the institutions thus far? I know we had the ventilators coming in and so on. Could you safely say that all of our main institutions are outfitted with those?
Yes, we have all of our institutions now having ventilators, oxygen concentrators. We have a larger ICU at Ocean View now. We have a bigger capacity there. We have more ventilators there. So we have improved vastly from what we had previously. And therefore, we can cater for larger amounts of patients, especially in the ICU setting. Apart from what we have centrally here in Region 4, we have also built a capacity out in the regions, so we can manage some of these patients out in the regions as well.
All right. You mentioned just now that these medications like remdesivir and so on, they're not magic bullets. And we have stated this many times, but just to reemphasize, what is most important to do in terms of trying not to contract the virus?
Well, prevention. And that's why we keep emphasizing that, because prevention is the way to go. And one way of preventing this disease from spreading is to wear your mask, do the social distancing, and of course to wash your hands and so forth. Now, these are simple measures. These have been tested in other types of pandemic where you had these types of viruses, and they have worked. So we know what can really make a difference. What we need to do is to get people to comply and to practice these things.
All right. Let's talk about, well, we just discussed hand washing and so on, but before we move off of that, I wanted to ask you specifically about training. We haven't touched on it, and I know we're coming to the ending of the year, so you had said that coming into the new year, we'll have some new aspects of training. Could you give us a bit of a reminder of those?
Yeah, well, we did quite a number of training sessions for this year, which include the most updated guidelines, because we want to have some uniformity in how we treat people and for people to understand the types of medication and so forth that you need to use. So we have conducted a number of training sessions for doctors working with COVID-19 patients. And we have also done similar things for nurses. We have also done training in terms of infection control, and we have had several sessions dealing with infection control. And this has to do with how you put on your PPEs, how to, when you're going into an environment that is a high-risk environment, what you need to do before, what you need to do while you're there, what you need to do when you come out. And this training, we have done quite a number of it in all the key institutions, and we have trained a number of trainers so that they can pass on this information. We have done training for persons who would be operating the ventilators and oxygen concentrators. So a number of persons have received that type of training. We have done training for laboratory personnel so that they can understand how to do swabbing, to take off samples for PCR. They can understand how to do antigen testing. And now we are conducting another set of training in the use of the Gene Expert machines. So these are ongoing efforts, and we have started to prepare the training material for the rollout of a vaccine. Next year, we are going to do similar things, refresher courses in terms of treatment and care. By next year, guidelines might change, so there would be new medications that would be coming out. Some might be available to us. So as the medications change and become available to us, we'll put them on our guidelines. And therefore, you'll have to refresh people in terms of the training. Similarly, upgrading our laboratory staff, we would want to ensure that more of our regional staff understand how to use the Gene Expert machine. We want to have more people understanding how to use antigen testing. So a lot of this type of training would be done as well. And of course, we'll do more sessions pertaining to infection control. So we are going to roll out some of the things that we have done in the past, but using new information that is available to us. We'll roll out upgraded training, so to speak. In addition to that, you will see us do some work early in the new year pertaining to training people for vaccination. As I said, this is going to be a lot of people we'll have to deal with. We are dealing more with an adult population, and therefore, we'll have to train people how to work with an adult grouping. With that training also comes a number of components which deals with how you register a person, talk to persons about possible side effects, what they should expect, get their consent, give them the vaccine. Then we have to do a follow-up depending on which vaccines we are using. Either people might have to come back after 3 weeks or after 28 days to get a second dose. And therefore, we'll have to follow up these persons. We also have to, depending again on the types of vaccine, maintain cold storage, meaning that the vaccine must be kept at the right temperature, because if you don't have these vaccines at the appropriate temperature, they can spoil. That would cause a lot of wastage. So we have to train our staff to understand these things. The two vaccines that are currently in use, which is Pfizer and Moderna, require special temperature control. Pfizer requires a -70, while Moderna requires a -20. We have not had such types of vaccines in Guyana where you require these types of temperatures. So it is important that we get some expertise in this area, and we work with people who understand how to utilize this ultra-cold chain. So we have spoken to the COVAX mechanism, and we have applied for a grant and to get an expert in from or through COVAX, technical assistance, in terms of working with ultra-cold chain. And we're expecting a favorable response from them because this is totally new technology to us. So all of this type of training would happen early in the new year as we prepare for the rollout of a vaccine sometime during 2021. And of course, other training that is necessary, we'll continue to do that.
Okay, sir. Two things. I wanted to ask you more about the G-Expert machine, and you mentioned antigen, and I wanted to ask you specifically about our overall daily testing capacity now that we've added those to what we had previously. So, the G-Expert first.
So a gene expert machine can be used to test for many types of diseases. And a lot of our staff are acquainted with these types of machine because they've been using them in terms of TB. We had about 5 in the country, and we have recalibrated those, and we have been able to secure special cartridges to test for COVID-19. So those 5 machines have now been recalibrated, and we are capable of using the COVID-19 specialized cartridges to see if someone has COVID-19. And we have now trained our staff, and we have deployed these machines to some of the regional hospitals. In addition to those that we have recalibrated, that we had in country, we have purchased about 5 others, and we are expecting them to come into the country shortly. And the cartridges, we are securing those from PAHO WHO mechanism. So we have a couple thousands of those in the country, and we are utilizing that with these machines. So at the regional level, this would be another set of testing that would be available to the regional hospitals. Now, with antigen tests, the antigen tests would test for a piece of the virus. And so they're fairly accurate. If you get a positive result with an antigen test, it means that that person is positive. But if you get a negative result, there's still a possibility that that person can be positive. So you'll have to revert to do RT-PCR tests. And we have constructed a protocol that allows for us to do these types of testing. The advantage of antigen tests, and especially the ones that we are using, is that we are able to test someone within 20 minutes. So once you take the nasal swab, you're able to put that in a specialized solution, and then you take a few drops and you put it on a slide, and you wait to see if the marks appear. So these tests can be done very quickly. That's why they're called rapid tests. And we have sent out a lot into the regions. We have bought about 50 or 60,000 of these tests, and we have them available in the country. So we don't have a shortage of them. Now, one of the ways that we have been using them is to use them on symptomatic patients, meaning that if persons have, a fever, a cough, complaining of fatigue and so forth, then we want to check that person just to rule out COVID. And this is a very quick way of verifying that they don't have COVID. We have a number of persons who would come into the hospital now that we have shifted persons away, the COVID-19 patients away from GPHC. We wanted to open up other wards, so persons who needed surgery and so forth. We are now trying to work on some of the backlog that would have accumulated since March. So we are able to use these tests to check persons as they come into the ward to see whether they are COVID positive or not. And of course, if they're positive, then we're able to take precautions and to move them to this more specialized facility. So these tests are helping us in many ways. In the outlying area, it gives us an opportunity to do them very quickly, be able to make a diagnosis, and to treat those patients or to isolate them. and in some other settings, like in the hospital, to be able to screen patients to see whether they're positive and to be able to do the procedure once they're negative. So we have really been working with this test now for about 2 weeks. We have trained persons in every region of this country. So all the regions have capability now of using the tests, and we have sent out enough kits to them so that they can utilize these tests.
All right, I just have one other question for you before we wrap up, and it goes back to the gene expert machine. Is this another form of testing that will be done added to those two that we already have?
Yes, it is. So it's another layer, and it's another opportunity. So in terms of testing for the virus, let's say we put it at 3 tiers, right? So we'll have tier 1, which would be like your antigen tests. So we know that there's still a leeway there for a false negative or result. So that tier 1, while antigen tests are really sensitive, so if it's positive, then we know it's positive. But if it's negative, there's still a possibility that that person could be positive, but we missed it with the antigen test. So then at that layer, then we can scale it up a little bit to make sure that this second level is a little bit more sensitive. So then we can use a gene expert test. It's much longer than the antigen test, right? Takes more time, but we can still do it at the regional level. So they don't have to send the sample out to Georgetown. And then from that, if we still have any doubt, after we have run the gene expert tests, we can then still take a sample and send it out to do the PCR test that we do in Georgetown. So we have different tiers now that we've added in terms of our testing, and which would help us to make better diagnosis, fast diagnosis, right at the point of care, because these gene expert and antigen tests are sometimes referred to as point of care tests, because you can come in, you get your swab, you wait a little bit, and you get your result. So we have moved to that level now, so the waiting time, we are cutting down a lot of the waiting time. There would be exceptional circumstances where we'll have to send those samples into the main lab, and we have now added more capacity at the national lab, where we are capable of doing about 1,500 tests per day. But I don't think we'll need all of that capacity because of all these additional things that we are doing. But nevertheless, we are very happy to have that capacity just in case we need to.
All right, Minister Anthony, thank you so much for speaking with us.
Thank you very much.
All right. Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.